Professor Helena Teede, Professor of Women's Health at Monash University, Director of the Monash Centre for Health Research and Implementation, and Head of the Centre for Research Excellence in Women's Equity in Leadership in Health and Academia. I had the incredible privilege of an amazing education. I wanted to be a nurse, but ended up choosing to start medicine first on a family friend's advice. After doing my medical degree, doing my specialty degree, doing my PhD, 18 years of education, I found myself coming out assuming that I would have the career opportunities that my male colleagues had, and they were just not there. And I could not see why they were not there, and was actually starting to think that was my personal problem. And I was second guessing my confidence and not necessarily being motivated or having the opportunity to step up into roles that I just assumed I would be able to take up. I co-parent with my partner. I have 2 children. So there were lots of challenges when they were young, but there was nothing in the system that was helping me to overcome my career. And yet it had no impediment or impact on my husband's career at all. And once you start to see that inequity, you can't unsee it. So I struggled for many years not really recognising the barriers that were there and really feeling often like I didn't want to behave in ways that I saw people around me behaving or as leadership. And I felt more and more uncomfortable with this concept of, but I really like to fix that, but I don't think I want to be in a leadership role. Indeed, many of my colleagues in senior roles, they were not role models. I did not want to lead like they led. And so I found myself happy to stay or content to stay in positions and not aspire to being able to have more impact because of that. Then I did an exec MBA, which I was tapped on the shoulder to do. Most profound change of my career and really has led to almost everything I've done since. And the different positioning, the facilitator said to me at the end of this 18-month part-time course, Helena, do you aspire to have power? I'm going to stop and let you reflect about that. My immediate response was no, because to me, power is Donald Trump, authoritative command, control, all the things I hated about leadership. And I instantly said no, and I would not have gone anywhere near it. And then he sat forward and said, Helena, what right do you have to define power in that way? Your purpose, because we'd already done that, is to have influence and impact with your patients, with your junior team, with your organisation, and potentially more broadly. But if you don't think you want power, you will never get that influence, because the reality is that influence and inspiration and leadership is so much more powerful than command and control. So redefine leadership and run it your way, and do it the way it suits you with a different style and different voice. And just because it looks different doesn't mean it's wrong. It's actually almost certainly the best way to do things. That conversation changed everything for me. And then I repeatedly saw others fall for the problems and the challenges I had and realised we just had to do something about that. The problem of women failing to have the opportunity and career trajectory to move into leadership has seemingly been intractable. We've been talking about equity for decades, but the reason it hasn't changed is we've just basically blamed individual women in the system and left it up to them, or blamed individual men for being part of the problem. We haven't recognised this is simply a cultural systems workplace problem. The barriers are in the systems that we have, they're in the workplaces and environments they're in. This is not a battle between men and women. It is basically a social and cultural construct, and it's embedded in the systems and the policies that we work within, which means it is totally fixable. Getting over that personal individual perspective to recognising this is about cultural and systems change, which requires leadership and collaboration, then we can definitely start to fix that problem together, and that's what we're now doing. To be perfectly honest, I'm really passionate about addressing it, because when you see these problems, you can't ignore them anymore, you can't unsee them. And having for so long not seen them myself and just questioned myself and thought that I didn't want to behave in a certain way because that was what leadership was, or I perhaps couldn't do this, and second guessing myself all the time, and seeing them do the same thing, enough is enough. We have to fix it. And so I get really passionate about making sure that everyone really in the workforce, women, people of different ethnicities, people of different ages, people of different cultures, have the opportunity to recognise their value and have the motivation and opportunity to contribute in a really productive way without all of those layers of societal workplace barriers that stops them from being able to contribute what they really need to. This is not just a problem of women not having the capability. In fact, they are more than capable to lead. And it's not necessarily a problem of them not stepping up and taking these roles. They're not motivated to take those roles because the way their roles are constructed and the lack of support and childcare and policies that we have don't make them appealing. So they don't have the motivation. And then there's all these barriers in the system that prevent them from having the opportunity. So when you see these things and you know they're there, it's really frustrating. And you know that it's our responsibility to fix it for the next generation so they don't need to struggle like so many other women have before them. The three key things here are capacity. Women in Australia especially have much less capacity because we take all the mental cognitive load, we take almost all the running of the household, and we take almost all of the parenting. It's very hard to get paternity leave. Our systems are very biased towards women taking all of that role. And what we're starting to see is more women choose not to have children. We really need to fix those problems so they're more equitable and we have the capacity. The second thing is capability. We are conditioned to think that we are submissive, we are less capable of leadership, we don't fit the stereotypal masculine leadership profile, so we don't think we're capable. We have imposter syndrome, we second guess ourselves, we don't negotiate appropriately, we're not paid as well because we come from this frame of not being as capable. And in fact, that's not true at all. And the third is credibility. I am not a Caucasian, white, 50-something-year-old male. At least for me, I'm a Caucasian white female. I don't have many of the other barriers. But the reality is we think leaders fit a certain stereotype and behave in a certain way. And if you're not there and you're the first person or the only person, so many times in my career, I was the one woman 20 years younger than my 14 other male colleagues. To their credit, they were very respectful, but they didn't listen to me. They didn't take me seriously. My perspective was seen as the token woman. And actually, that was not necessarily their individual fault. It was the construct we have about what is a credible leader. So when you see the capability, the credibility and the capacity issues, and you know that the only way to fix them is not an individual fighting or being like the many leaders they see around them, but actually getting that diversity and true self to the table by creating a different paradigm where we can create a fair system for capacity, childcare support and other things, co-parenting, where we can build confidence in people who would be very capable and bring a diverse voice to the leadership table, and where we accept that credibility and leadership is a diverse picture. When we get there in healthcare, of all fields that should embrace this in terms of equity, we will get a much better healthcare system that actually meets the need of people who are actually the funders and the beneficiaries of our healthcare system. You know, I used to be a believer that merit was about, have you been overseas and done your cardiology fellowship? Have you presented at conferences? Have you written 15 papers? Because they were our markers of merit. Actually, they're just markers of privilege. Merit is about understanding that's the best fit for the job. And our judgment is not understanding where people are at the starting line. If you are a woman and you've got a family and you're the primary carer in that family, you don't have the same capacity to be able to go off overseas and do all of these amazing fellowships unless your wife is coming with you to support you or your partner is coming with you. It's about what opportunities people have had in life, what personal characteristics and skills they bring to the table, what support you can provide them, and then how can they contribute to the job, and whether you've got a diverse team to lead. Merit is the worst enemy of equity, and we need to see merit through a different lens and judge it based on opportunity and ability to make a difference and contribute. Why do we care if there are more women in leadership? Well, one would argue there are many reasons. First of all, women in Australia are much more educated now than men in terms of bachelor's degrees. And if we don't get people moving through to leadership, we're not harnessing all of that investment and effort. Secondly, it's really important to retain people in the workforce if they want to have career progression. Third, for gender equity and pay gap, we need to address this. But it's a social justice equity issue. Everyone should have the ability and motivation and opportunity to advance in their career for job satisfaction. But ultimately, we need more diversity, gender and otherwise, in our leadership because we provide better healthcare when we hear the voices of the people for whom we're caring for. And there are countless examples of that. What would I tell my 15-year-old self about leadership? You can do this. You've got this. Don't second guess yourself. Don't assume that you can't do it, even though the constructs around you would suggest that you can't. Don't worry about being different and looking different to the people around you. You have a voice, you have something to say. And the more diverse and different you are to the other leaders around you, the more valuable your contribution is going to be.